Welcome to Bringing Better Health to Life, sponsored by Conway Medical Center. Our guest is Dr. Andy Gresko, and he is with Waccamaw Cardiology. And Andy, I remember interviewing you when you first came to town. So you've been here how long now?
15, 16 years.
Doesn't seem possible.
No.
Tell us a little bit about your background, how you got to Conway, where you went to school, those sorts of things.
Okay, well, as far as medical school, University of South Carolina, School of Medicine, and actually did undergraduate and pharmacy school there prior to that. But born and raised in Cleveland, Ohio, was enlightened and came to South Carolina in 1979, and then from there have been here. After medical school, though, then went to Emory there in Atlanta, did my 3 years of internal medicine residency, and then came back to Columbia to do my cardiology. From that point, I then joined the Myrtle Beach cardiology practice in 1995 and started the practice here at Conway, Waccamaw Cardiology, in 2000. And the neat thing about that whole transition, it was really based on trying to do the right thing for the people of the community. The group at Myrtle Beach, great people, and we were trying to serve both areas, both communities, and it just wasn't working with the number of people we had, so we just felt like we couldn't keep doing it. But on the other side, I was the spokesperson for our group, and they felt it was only the right thing to do to give me a chance, if I wanted to start this practice. And after talking with my wife, who is from the area, and just making some personal decisions, we went ahead, and so in 2000 started the practice, and for a couple years by myself, but then I was fortunate to have Dr. Keith Weitz join me in 2002, which then led up to just recently Dr. Rosenblum joining us this past summer. So it's been exciting and just great to be part of it.
At what point should a person see a cardiologist? And perhaps that leads us into family history.
That's a good question. I think the first step would be a primary care physician, making sure that everyone has a family physician, internist, or just a primary care giver taking care of them so that their general needs can be met in screening. But from the cardiology perspective, we really start looking with males at age 45, females age 55 is when their first risk starts based on age. But there's other risk factors. The other risk factors include something big as in tobacco smoking. You have family history. You have high blood pressure, diabetes, or high cholesterol. Any one of those three that can be picked up earlier on by the primary care physician, but then we can add insight and a little more depth to that. So that is kind of where we would start. Once people are noted to have risk factors, then workups may vary from one individual to the next. I would say that most people at age 45 with a risk factor would definitely be leaning for the general population, probably considering a stress test at that time for males, and again, females at age 55. New technology, new testing has come along over the last 5-10 years, and that's the CAT scan. The CAT scan's always been around, but the problem is it's a heart beats 60 to 100 times a minute, and to try to take pictures of a moving heart is a very difficult image to acquire. So now that it can get 64 slices within a very, very short period of time, we're able to now get pictures of the artery. So that CAT scan of the heart arteries allows us to tell if people have disease or don't. And if they have disease, is it mild, moderate, or severe?
How important is it that people have their cholesterol checked regularly if they know they have a family history of heart disease?
I would say the cholesterol would start early on, and I would think sometime in the 20s and 30s, and any more, I would even consider it within the children's age, just because obesity is becoming such an issue, adding to the risk factors. So I would get that checked early on, 20s, 30s, definitely by the 40s. And there's certain goals that are set out by the American Heart Association and American College of Cardiology based on your risk factors and what we want that cholesterol level to be. And it's not the total cholesterol, it's the specific bad cholesterol. Yes, there's a good cholesterol, and we like it to be high, but is there good ways to bring it up is not as scientific to say if it goes up, you're better. But that bad one, if we get that low, we know statistically you decrease your risk of having a heart attack, heart failure, hospitalization, or even sudden death.
The topic is heart disease, and we're going to take a break, but we will return to bringing better health to life in a moment.
The Conway Medical Center website provides visitors with a comprehensive resource for their health and wellness inquiries. From our homepage, just click onto Search Health Topics for direct access to the HealthWise knowledge base, where you'll find over 5,000 topics about health conditions, medical tests and procedures, medications, support groups, and everyday health and wellness issues. At Conway Medical Center, we know that better informed patients make better health decisions.
For over 50 years, it's been our mission at Garden City Furniture to offer our customers quality home furnishings at an excellent value and to provide personalized service that is second to none. You'll feel at home at Garden City Furniture on 17 Business in Garden City.
This is Bringing Better Health to Life with Conway Medical Center. My guest is Dr. Andy Gresko with Waccamaw Cardiology. And Andy, you were talking about heart disease, and I want to know if we know that our family history is there, what can we do to change it and make a difference?
Well, we can't change the family history. Of course, that's given to us.
But we'd like to.
Sometimes various ways, but we're blessed with what we have, and we move from that, and then the things that we can do something about. The biggest thing is smoking. If someone is smoking and stops, they decrease the risk of a heart attack by 50%. There's nothing I can do that's any better than that. Then you come to other areas, say nutrition or exercise. With risk factors or no risk factors, lifestyle change is important. And it's not a diet. It's truly a lifestyle change. So that if you're getting into the exercise program, getting into a nutrition program, in kind of an ABCs from activity or exercise, I would say the minimum you're trying to do is to walk, jog, swim, bike, or any activity like that that's aerobic for at least 30 minutes to an hour, 3 days. But try for 5 days a week, 6 days if you like. And if you only get 3 days, you're still doing the job you need. It does two things. One is it's going to help decrease the risk of heart disease and by far give you good health. But secondly, mentally, I mean, if anyone that's ever done it, they'll realize that it's almost like recharging or rebooting that computer. All of a sudden you feel refreshed and vigorous. You're not going out there as we were taught as kids, no pain, no gain. You're trying to do a pace. You're trying to do something that you're comfortable with. And kind of a rule of thumb with exercise too is you want to be sweating for about 15 to 20 minutes. And then, do that 30 minutes plus and then, of course, cool down. When it comes to nutrition, I think we've all been taught what's good foods and what's not. So I would go past that and I would say, let's look at what we're eating and how much so that try not to have those second helpings. If you do, make it the vegetables. Make it stuff that's not as calorie, but try not to have those second helpings. Secondly is the snacks. Try to minimize or limit the snacks. If you're having desserts, maybe 1 or 2 a week. And outside of that, I think just being kind of balanced in your approach. So I think that's a good way for everybody to live. And if you have risk factors, definitely it's important.
Let's talk about the warning signs. I know that for men it's totally different than women, and yet it's so unpredictable, isn't it?
It is. And, all these things are based on statistics and research that led up to it. So the initial warning signs that we've all been informed of, the chest pressure, tightness, squeezing like discomfort, sometimes radiates to the neck, shoulders, or arms. Some people have shortness of breath with it, some people don't. That was studied early on with males, because I mean, if you figure a 40-year-old male dying suddenly in the responsibility with the family, that was a big thing. So people looked at that because it was earlier on, where females weren't having those issues until their 50s. So I think that's what led more people to concentrate on the males. So what we see is the signs and symptoms that you hear about, as I just discussed, are the ones you see with the males. As females, It may be burning. It may be a sharp pain. It may be something else. But the thing that I would still put my hat on is if it's happening with exertion, you stop and it goes away. Be it fixing the bed, putting up the groceries, walking to the mailbox and back. If you get those kind of symptoms, be it chest pressure or pain of any sort, or shortness of breath, you may think, oh, I'm just getting tired. Well, if it happens all of a sudden and you've never had it before, that's different. It's a red flag. You need to have those things checked out.
Great advice for us. We can't thank you enough. I wish we had another hour to talk about heart disease. Dr. Andy Gresko, thank you so very much for being with us here on Bringing Better Health to Life.
Thank you.